This multimedia presentation will discuss the ways in which having an abortion can affect emotion. Induced abortion or termination of pregnancy is a deliberate cessation of a pregnancy resulting in embryonic or fetal death. Having an abortion can evoke an emotional response both before and after the procedure. Prior to an abortion, many women experience higher overall anxiety levels. However, this usually dissipates quickly after the procedure. Immediately after an abortion, women usually experience a significant decrease in anxiety. Any residual emotional reactions usually subside within the first month. Long-term emotional responses to abortion may include regret, guilt, or relief. However, most women do not experience many effects in the long term. So what factors affect how women respond to abortion? One important factor is choice. The greater a woman perceives her ability to choose whether or not she has an abortion, the better she will cope. Legality of abortion can affect how a woman responds. Greater legal restrictions limit a woman's personal control over her body, and such control is important for coping adaptively. The greater the stigma a woman perceives about her abortion, the greater the likelihood of experiencing negative emotional repercussions. Furthermore, if the experience of termination is positive and non-traumatic, this will provide the best foundation for coping effectively. Additionally, social support from friends, family, partners, and even staff in a termination clinic is very important. Some cultures and religions still see abortion as unethical. If a woman internalizes these views, she's likely to perceive her decision in a more negative light. Lastly, personal characteristics such as high self-esteem, a strong sense of personal control, and an optimistic appraisal style predict better emotional response. One theory that helps to explain emotional response to abortion is Lazarus and Folkman's transactional model of stress and coping. This theory ascertains that people make two types of assessments about situations they encounter. There's a primary appraisal in which the individuals assess how the event may affect them, and a secondary appraisal, which involves looking at the resources the person has available to deal with the situation. One further theory is Bandura's self-efficacy theory. Self-efficacy refers to the extent that an individual believes in their capacity to deal with adversity. And lastly, Beck's cognitive triad helps to explain emotional response to abortion. The theory states that the way we perceive events affects how we cope with them, in that the more negatively a person perceives events, the greater negative emotional consequences they will experience. I hope that this short presentation has helped you better understand